833 and nearly 60 million Americans suffer from arthritis. The chances are you or someone you know is one of them. So let's talk about some of the numbers. Arthritis, the #1 cause of disability, and those numbers just keep going up.
I mean, look at this. 1 in 4 people are diagnosed with arthritis, and that includes, get this, almost 300,000 children. Wow. I had no idea. Dr. Karena Wu, owner of ActiveCare Physical Therapy, is here to talk about prevention, treatment, and management of this condition. Good morning, Karena. Thank you so much for joining us.
Good morning.
We have to talk more about these children. I had no idea that there are that many children prone to arthritis.
Yes, there are many, many children, nearly 300,000, that are affected with juvenile arthritis.
What are the symptoms, and what does that include for them? Like, how does it affect their life?
So arthritis is like an umbrella term, and it literally means inflammation in the joints. So it means you're going to have pain, swelling. It could be local, like in just individual joints, or it could be systemic. So it's going to cause, you know, pain and dysfunction and inflammation around their system.
Yeah.
And it's oftentimes undiagnosed for quite some time.
Well, because you don't think about arthritis being in children. You think about it usually in older adults, right? And there's actually more than 100 different kinds of arthritis.
Yes, arthritis is that umbrella term, so it can be the osteo, the psoriatic, and the rheumatoid arthritis. Those are the big ones that we hear about. But it can also include ankylosing spondylitis, lupus, gout, and fibromyalgia. And it can affect local joints, but it can also be systemic, which means it affects the whole body, your bones, plus your soft tissues and your organs.
And you not only treat, but you also are your own patient, correct?
Yes.
So what type of arthritis do you have, and what are you doing to...
I was very lucky to have osteoarthritis. It's in my knee. It's actually in my hips and as well as my neck. And I had surgery October 2022, just had stem cell injections. So I learned, doing my own market research on my body, that the osteoarthritis, as local as it sounds, it's just, you think it's just the bones, right, and the cartilage covering. It goes down deeper into, like, much deeper in there. So having stem cell injections was one of the treatments that I used that really helped, because it helps heal from within.
Wow.
So you just think it's like the most superficial part, but it really can extend quite deeply, and to the other surrounding tissues.
So here's the thing, like, you're zeroed in on your knee, right? And so for somebody else, it zeroes in on different parts of their body, obviously. How do you prevent it? Is there a way to prevent, like, say, you from getting that osteoarthritis in your knee early on?
So there is a genetic component, but also if you keep your body strong and healthy. As a physical therapist, I'm always going to tell people that. But doing the appropriate exercises, so you can do stability exercises that are more isometric. Maybe if you can't move the joint well, you're just going to turn your muscles on and just hold it in a spot so that the muscles are activating and recruiting the muscle fibers. But also doing flexibility exercises keeps the compression low in the joint, and it also allows for the muscle tissues to reactively react as well as activate while during an exercise. Those are important things to do.
If arthritis is about inflammation, does food have anything to do with it?
Yes. Avoiding things that are inflammatory, like alcohol, processed carbohydrates, refined sugars.
All the good stuff.
All the good, unhealthy things that we already know that we shouldn't be eating.
Right.
So other healthy fruits and vegetables, nuts, berries, avocado, omegas, any sort of foods like that, those are going to be beneficial and help with the anti-inflammatory effects.
Oh, geez.
So you're walking to help find a cure.
Yes.
So talk about the walk, what you hope to accomplish, money raised.
Money raised. We're going for $300,000.
Wow.
It is the Walk to Cure Arthritis. It's the big one in New York City. My team is ActiveCare Physical Therapy.
Okay.
The walk is Saturday, May 18th, so next Saturday.
Yeah.
It's down in Foley Square. It starts at 9 a.m. I will be co-hosting with Anna Villafane, who is a Broadway actress, and it's just a lot of fun. You know, it's my community give back, but it's something that's near and dear to my heart. And like we said, so many people have arthritis, and the numbers are growing. So that is a big deal. And we're just trying to generate money to find a cure, continue the research, exactly, and then actually help improve the quality of life for people with arthritis. Especially with juvenile, they actually fund kids to go to camp for families that can't afford it.
Great.
So yeah, it's a big deal, and it's really, really nice to be able to give back.
Yeah. Okay, good stuff all around. My gosh, I feel like everybody has arthritis. My gosh, right? No, but seriously, I feel like it's like one of those things that people just are always complaining about some sort of joint pain somewhere.
Yes, well, the systemic ones are definitely becoming, there's an autoimmune component, so you have to be careful because we do eat, bad food sometimes, but then also the osteoarthritis is more local, so it's going to be in your weight-bearing joints and in areas that are getting a lot of use.
All right.
Appreciate the work you're doing.
Thank you.
Good luck. Hopefully you have a good weather this weekend. I think it's so far so good looking at that, right?
Yes.
So thank you for being here. Good luck with the walk, okay?
Thank you.
8:30.